Introducing John Yu is more than a personal pleasure. It's just about time that we got back together. John introduced me to the Children's Hospital when I was at Camperdown, and the interview consisted of a very brief chat. And he says, "What do you think about this idea of starting an adolescent unit?" And I said, "That sounds fine." He says, "Come and do it." And then he introduced me to Kim, and then that was it. The rest is history. But John is probably one of the most recognised figures in paediatric medicine in Australia. Is certainly identified for his work with the Royal Alexandra Hospital for Children and the commissioning of the new hospital at Westmead. He envisaged it as a very creative place, a total healing environment, and it certainly has continued to be that. John was honoured as Australian of the Year in 1996, the first Asian Australian to be so honoured, and he received the Companion of the Order of Australia in 2001. So there wouldn't be a person present in this room or elsewhere in the country who's not extremely proud of his achievements. So who better than an icon like John Yu to talk about what paediatrics has achieved over this past 4 decades. Please join me in welcoming John.
Thank you very much, David. Former Minister Peter Collins, and all the people that were very instrumental in creating AWCH and then maintaining it. I think, Dennis, you might have been, were you the first president, or you were very close to being the first?
I was,
Yes, well, it's great to see you again after a long period of time. David said I could talk about anything I wanted to. The big difficulty is that I wasn't sure what the minister was going to say, and it's really hard preparing a speech which in any way contradicted ideas the minister might have put forward.
Giving you a free rein.
But yes, the minister has been very generous. I think, Minister, you may well have been the longest serving shadow minister before you're actually appointed minister. And I think that must have been a really useful exercise. The first time I actually met Julian was when our public relations officer said to me, "There's somebody having a press conference down the street outside Camperdown."
Not me.
Yeah, yes. But it was really interesting in that Julian showed a lot of initiative in going out to the place that she was speaking about. Now, there was a great deal that was wrong about the way we looked after kids. Not so much about the medicine or the nursing, but the way we viewed their emotional and social needs. And certainly a hell of a lot we ignored about the needs of families. And whilst I think some of the early pioneers in AWCH might have seen me as an enemy, I actually really wasn't. And in fact, with AWCH, all sorts of things happened at Camperdown, like extending visiting hours, having pictures on the walls, having mobiles hanging, even though the matron of the day said to me, "Laura, a health hazard because dust and germs would be in the mobiles." But never mind, I'm saying we've all moved on from there. AWCH has achieved extraordinary things, and they've made all of us recognise those things that really make a big difference to a child and a family, particularly one who is acutely ill, and especially somebody who's chronically ill. I think one of the great things, one of the great compliments of AWCH is that about 20 years ago, there probably wasn't the need for an AWCH. But they continued on, they found new things to do, the ward grannies system. But there are new challenges, and they're very different challenges. Today, lots of children are looked after in our public public hospitals, who aren't in children's wards, because there aren't children's wards. And there's no point of us getting very excited about it, because the realities of life is that everything has changed. Medical science has changed, health service practice has changed, and our attitudes have changed. So kids don't stay in hospital for days and days, and so much is done in day surgery. The health budget, despite how much the minister might fight, will never be enough for the needs. And so I think we need to be realistic and say that the sort of things we always demanded is a ward and a bed dedicated for children, with nurses with the appropriate paediatric experience, may not be practical and certainly not pragmatic in today's world. I think we can, through the minister and her department, ensure the children who need to be looked after in truly understanding, knowledgeable paediatric environments are transferred to those environments. Now, I would hate to think that anybody in the health system will ask to fill out more bits of paper, but I think it really would be very interesting if the department received, weekly or monthly, a list of those children who were looked after in hospitals that didn't have a paediatric board, and just to see that what was done was appropriate. Something very simple, I'm saying. Name, age, diagnosis, and then one could look and see. But AWCH's work with ward grannies is really very important, and I hope that continues. But I think AWCH has a greater challenge, and that is those children who aren't in hospital, who have chronic health care needs, and they aren't necessarily physical health care needs. And I would hope that AWCH might think up some way where we can help support kids and families in the community, at no stage ignoring their initial passion for children in hospital. But it's too important an organisation, and there are too many committed people, not to try to use them a little more constructively in the future, so that you don't go around trying to find something to do, because there's an awful lot there that needs to be done. And if it's done within the structure of the health system, then I think you'll be able to get a lot of satisfaction, professional support and help, and the kids and the families will be very much better off. I'm proud of what AWCH has done. I'm proud of what we in the Children's Hospital, the old Royal Alexandra Hospital before it was incorporated, has done. And I would like to pay one tribute before I stop speaking, and that is to say thank you to Peter Collins, who had the faith to enable a group of us to do what we thought was right. That was to get an environment appropriate for kids and families, because without Peter, it would never have happened. I don't think it's telling tales out of school to say that the department was not supportive and said we were spending too much money per bed. But when you think about kids, you don't measure their care by bed numbers. So thank you, Peter. Thank you to your government at the time. I'm not sure whether it was Nick Griner or John Fay, but one, or both of them, but you really made it possible, I think, for a standard of healthcare for children and their families be established in this state. And I don't have any doubt that that standard will continue to be protected and nurtured by Julian Skinner. Thank you, Minister.